So today, class, we're going to do a center line dressing change, and on the table here I have basically all the supplies that you will need for them. I have a mask for the patient. We need to make sure that their face is covered and that we turn their head away from the dressing site so that we don't have any risk of any bacteria going into this line that goes directly into their heart. So I'm going to be very, very careful. I will also be putting a mask on myself during the procedure, at least until it's covered again with a dressing. Now, it's a triple lumen, and so I have 3 flushes here and 3 heparinized flushes. Based on facility policy, some might be heparinized, and so that's just something that I'm going to show you the technique of. Just know that you would want to check your individual facility's policy to see if that's necessary. After we do the scrubbing of the wound site, we're going to go ahead and put a biopatch on. This is impregnated with chlorhexidine, and so that's going to be an extra deterrent from any bacterial growth happening in the wound. And typically we will change out all of the HepLock caps, but just for interest of time, I'm only going to show you changing out of one. This is the sterile dressing that we would be placing over it after we cleanse it. I've got my sterile gloves, and I have my 2 different types of scrub. Of course, you would only use one type, but just for demonstration purposes, I'm going to show you the proper technique for using each one. So we will scrub it twice, even though in the clinical setting you won't actually do that. And then I have some tape to put, just a little trick to show you with that. And then I have my Curos, which is what we would put on after we get that. And I also am going to have my lovely assistant get me some clean gloves, size medium, and some alcohol swabs, because we always want to make sure that we have all of our supplies, and so I make sure that I have everything. I kind of go through the procedure mentally in my head as I do these steps, so that I make sure that before I start, because I'm going to have a sterile field, I want to make sure that I'm going to have everything that I need. And I realize that I don't have my alcohol swabs, which normally in my nurse world would be a stash in my pocket. Thank you. And so here we go. So the first thing I'm doing is come around the bed, and I'm going to introduce myself to my patient. Hello there. How are you, Mr. Cruz? I'm just going to check your name band here. It's time for the dressing change that's going to be on your central line that's been inserted by the physician there. So we're going to do that, and I'm going to go ahead and check your name and date of birth right here. Ryder Cruz, and your date of birth is 5/21/87. I show that you have no allergies. Is that correct? I will be using a chlorhexidine on you, so I want to make sure that you're not allergic to any kind of antiseptics or anything like that. None. Okay, great. So now what I'm going to do is I'm going to lay you flat. So I'm going to put the head, I want the head to be completely flat. And then I'm going to have you put your mask on. During this procedure, it's really important that you stay away from this site. So I'm going to go ahead and turn your head to the side there and put your mask on, and then I'm going to put my mask on as I walk around the bed to the side that I want to be on. So I'm going to tie this mask on. Make sure that my glasses don't fog up while I talk. Okay, and now we're going to go for a ride, Mr. Cruz. I make sure that the bed is at waist, the working area is at waist height, because this is going to be a sterile procedure. So I'm going to bring them up to that level before I get started. Get my garbage can in easy reach. So let's go ahead and put this. Now, because I'm going to have my supplies set up on a sterile field, and I'm going to have this, when this dressing comes off, there's another sterile site. So I want to make sure that I have everything in order and I can see easily both sites. Remember, if I need something, I'm going to step back, keeping my eyes on my field on all times. So these are needed at the end. I'm going to go ahead and open up my open up my saline lock that I'm going to switch out, and I'm going to prime that. I don't want to introduce any air into central circulation, because that's a bad thing. All right, I'm going to go ahead and just open up my supplies here. I'm going to use my gloves as a, my glove packet as a sterile field. Remember that when we open up gloves, pinch them back like that so that they won't flip over on yourself. Open these up like that. Okay, now I'm going to go ahead and I'm going to put on my BioPatch onto my sterile field, dropping at least 6 inches above. Oh, for heavenly days. So this has been used by about 15 students. You would never do this in the real world. Garbage, but it's been used and reused, so that's why. Dressing's going to go on as well. Whew, didn't hit my 1-inch border there. That was kind of close. And I'm going to go ahead. This is a ChloraPrep 1-step. So I would take this, open it up, drop it on. That's what I'm going to use to clean with. And then I'm going to just show you this other one. It's called a lollipop stick, which is like a slang term for it. I would open it up so that both of these are down because the inside needs to stay sterile. And I'm going to go ahead and I'm going to tape it onto the side of my bed. Whoops. Tape it onto the side of my bed here. And let's see, I want to get over here, so I'm going to put that right there. Notice how I didn't reach over my sterile field to do that. Okay, so I'm going to look at everything, say, am I ready to put myself in sterile gel? I am. I've got my sterile field here with my supplies on it, but I'm going to just push that to the back a little bit, because first thing that I'm going to do is I'm going to put on clean gloves, and I'm going to remove the old dressing. Right? Clean touches clean, and sterile touches sterile. So I'm going to carefully work my edge here. And on Tegaderms, if you actually lift and pull away from the skin, from the site, it lifts much easier. See how that's just lifting off of his skin? And it causes much less friction than if I were to actually just kind of pull this way and rip. So I've got that. I'm going to pull from this edge as well. So I get everything off, and then I'm going to carefully remove that. All right. Now, this is where it gets tricky because I have sterile field here and sterile field there. I'm going to visually inspect my catheter. I want to make sure that the sutures are intact, that it is well applied into the skin. I don't see any ecchymosis. I don't see any evidence of like skin swelling or anything like that. And it looks good. So now what I'm going to do is I'm going to carefully reach in. I'm going to pick up one of my gloves and pick it up and put it on. Remember, high and away when you put on sterile gloves. You don't want danglies down here that can actually accidentally touch something and you wouldn't know it. Pull that cuff down. Now, this hand's sterile. I can go like this, I can move, I can do whatever I need to do. I can pick up my other glove because sterile's touching sterile. Remember to hide those fingers in there so that you don't accidentally contaminate. Put your hand into the clean glove. See, isn't that beautiful? It doesn't really matter because now sterile can touch sterile and I can pretty that up. Okay, I want to make sure that my fingers are nice, the tips are nice and protected, and that I don't have any little dingles. I call them dingleberries. Things hanging down. Okay, so what I'm going to do now is I'm going to show you the 2 different methods for cleaning. If I were to use the lollipop, I would take it out. I would put one side down directly over the site. Now I need to be very careful and not touch my wrist or anything. I don't want to accidentally touch sterile glove to there, so I need to be mindful of that as well. So I'm going to touch here in the center. I'm going to get it nice and wet, and then I'm going to scrub like this. And I'm never going to go over that site again until I flip it. So I scrub like this, and I can scrub vertically as well around. And then I'm going to flip it. Notice this part hasn't touched my patient yet, so I flip it. It's like a brand new sterile thing. So I'm going to hold that down again on here, really let it saturate and soak, and then I'm going to go in a circular motion away from the insertion site, like so. Once I do that, I can go ahead and I can scrub up these a bit too. Scrub underneath, like that. Okay, so that would be how you would do a lollipop. Now I'm going to show you, you wouldn't do both of these, but I'm going to show you how you work with these. This one doesn't have anything that I can flip, but it has a little bit more solution in it. Both of these will clean an area that's about 10 by 12 centimeters. What I do is I'm going to take, and I want you to listen closely because I'm going to pop it. So I pop it, and then that's going to, I broke a little cylinder in there that has the chlorhexidine in it, and I'm going to give it a few seconds to kind of get there, and then I'm going to just go like this, and I'm going to get it nice and juicy, and hold it right down there like that, and then I'm going to do the same thing. But because I only can touch this once, I want to just keep it there for a few seconds and let it really soak in. Then I would do the same thing, and I would go around like so, and I would get it all clean. Okay, same procedure, same concept, all right? So now it's clean, and we're done with that. The next step that I have is I'm going to put the biodisc on. The trick to remember with these is blue always goes to the sky, okay? You have this white part here, and this is a homemade one, okay? But this white part here is impregnated. That's what has the chlorhexidine in it, and so you want that to sit down on here. I want to make sure that it's nice and dry, and then I set this down there, and just see how I put it right along there. And so that is all ready to go, and now I'm going to put on my dressing. Separate out the two, set it down, and I want to kind of center it over my central line. Center it over your central line. All right, then come around like this, keeping my edges nice and occluded there. And then go ahead and pick up this one piece, and now I've got an occlusive dressing there over my central line. So, all right, so that is finished. So now I can say, you have been a great sport, Mr. Cruz, and so have I, and we can take off our mask because your wound is covered now. But I'm not done yet. I still have to take care of all of these heplocks here. I'm going to show you the push-pause method for cleaning these. Now, we were supposed to change out, we're just going to say that we're going to change out the medial one. If you look on here, this says medial, this says proximal, right there, proximal, and medial, and distal. This is how the lumens are stacked one on each other inside. And so the very first one is called the distal, so it's the center lumen that goes all the way down to the very end of the catheter. And this is the one that we would draw blood from because it's the largest lumen and it takes it directly through. All right, so that's that one. But we're going to go ahead and we're going to switch out this one. Now to switch it out, I'm going to remove the heplock. I need to make sure that this is clamped right here, because if it's not clamped and I remove this, my patient's going to exsanguinate. There's going to be blood everywhere. You pretty much only make that mistake once in your career. Okay, so I want to go ahead and remove this catheter top, and it's just going to sit right there. Then I'm going to take an alcohol swab and I'm going to scrub for a good 15 seconds here. I'm going to get in all the nooks and crannies because, you know, it's been laying on his bed. He's been sweating on it. He probably spilled some juice on it when he was eating. And so I want to make sure that it's really, really, really clean here before I put my new cap on. Okay, so now I have my new saline lock right here. Notice how I've kept control of this. I've kept it in my eyesight and I haven't let it go anywhere. So sterile tip onto here, lure lock on. Please don't go crazy. Just do it until it's lure locked on. You don't need to twist these on so hard, because if you twist them on so hard that the next nurse can't get them off, then you're going to introduce infection, or the doctor's going to say you can't use that lumen anymore because you can't change this out. These need to be typically changed out to prevent infection. Now, inside the lumen, there can be kind of some slime actually build up in there. And so when we clean these by flushing them. And when we clean it, think of like a washer agitating back and forth to get the clothes clean. We're going to do the same thing with the solution. So I'm going to take off that and I'm going to hold it. You want to hold it so that it's easily clamped again. So I'm going to put both of my fingers underneath here, and then I'm going to put my thumb right there. So now I can clamp it quickly like that as I'm finished, okay? So everybody see that? Fingers underneath, line above, and then thumb on here. Now, you have to use a 10 ml syringe or larger for the proper PSI. If you use a smaller syringe on these, they can be damaging to the lumen. It puts too much pressure on them. So it has to be at least a 10 ml or larger. So now I'm going to use the push-pause method. I'm going to go push, pause, push, pause. Think of that agitator of that washing machine. Push, pause, push, pause, push, pause, push. To create my positive pressure, push, clamp at the same time at the end. Okay, so I push and clamp at the same time. Now, I'm later going to do that with heparin, but I don't want to mix them up and I don't want to even think about it. So what my trick is I just leave the flush on until I'm completely done. Now I'm going to remove the Curo, and because there's a Curo on this one, I don't need to swab in between. And I'm going to take this flush, and you always make sure that there's not going to be any air introduced, so you take a little bit out till you have just fluid. Hook that on, pop off that clamp, hold it just like we did the other one, and do the same thing. Push, pause, push, pause, push, pause, push, pause, push, pause, push, pause, push, clamp. All right? One last one to do here with the saline. Again, the Curo, having been on for more than a minute, means that I don't need to swab, but I do need to prime my Heplock and make sure that I don't have anything in it besides fluid. Okay, go find that clamp. I think I'll bring it up here a little bit closer. Get it in position. Push, pause, push, pause, push, pause, push, pause, push, pause. Detergent. Think of an agitator. And clamp. All three of those have been saline locked now. Now, my facilities policy says we're going to add about a half a mil of heparin, or less than a mil. So what I want to do here is I'm going to take that off, and I'm going to make sure, notice how I put my cap so that I can put that back on there. If I had set it down like this or like that, I wouldn't be able to use it again. So by carefully removing your cap and then priming it, now it's ready to go. Because now I need to swab for a good 15 seconds before I put that next one on, because the manufacturers of the Curo say that if you take anything off and you're going to put something else on and you don't have a Curo on there for 1 full minute, then you need to swab in between. So I'm going to swab here for a good 10 to 15 seconds. And now I'm going to put my heparin lock on, or my heparin, sorry. And I'm going to open this up. And this is just so that the blood inside the line is not going to occlude, because you can get like a vacuum in here and it'll suck some blood up in there and you can create a thrombus. So all I'm going to do is I'm going to go push, clamp. I've put in less than a mil of fluid of my heparin. Okay, there's some debate out there on if it's okay to transfer this one to this one. I just cleaned it. I could choose to do that. So as long as I keep control of it, okay, so if this is on here and I get this one all clean and I take this off of here and I put it on there, or I can just use 3 heparins. And I think that's what I'm going to do this time. Okay, so that's ready. This one's done. So once it's clear, I know I don't need to mess with it anymore. So I'm going to hold that again, get another alcohol swab. And it would be okay to set it down, right? It doesn't really matter because I'm going to scrub it. Okay, so I'm going to scrub for a good 10 to 15 seconds. Just agitating it back and forth. And now I'm going to take this and I'm going to put it on. I've already primed it. I'm going to do my clamp skills here. Get it underneath like that. Watch my volume because I want to be less than a mil, so I'm going to push, clamp. Okay, so there we go. That creates that positive pressure. That one's done. Now I only have 1 flush left on there, so I know I have 1 more to go. So I'm going to take this off. I'm going to scrub it. I'm going to keep control of it and hold of it so that I don't mix it up with any of the others. Take off this. There we go. And push, where I can see, push, clamp. Okay. So it's dressed now. The one last thing that I need to make sure that I do, though, is I want credit if it's good, or I get the blame if it's bad. And I don't know who dressed this or when they dressed it unless I mark it. So I'm going to take a piece of tape here, paper tape, and I'm going to put on date 9/14/2016, my initials, and the time, which is 16:20. Now that's what time, the date and time that it was dressed. These can be facility policy. You would change it if it became compromised, if it was there was wetness underneath it, or if it had been 5 days, which is what our facility policy is you change them every 5 days. So that central line dressing change with one last thing that I get to do here, which is to put on new Curos. So of course we know these come on a strip. And so once I'm done, I'm going to take my Curo and I'm just going to slide it on like this and like so. And I know I had 3 of these puppies, so we'll just say that this is oh, here they are. I have all kinds of them. And then this one on right here. So now I've got my 3 Curos on so that they're ready for the next time somebody comes in to give a medication. Now remember, you have to have a 10 ml syringe. You always want to create a positive pressure before you clamp. So you push, pause, and clamp as you push so that you don't get the vacuum of blood coming back up into the line and coagulating there. That's another reason why we use the heparin. One last thing that I want to talk about with the central lines is that when you're taking care of them, these go directly into the heart. So you need to be very, very, very mindful of everything that you do with them. Be very careful in your practice so that you don't introduce sepsis into your patient. And that's it.